Bismillahirrahmanirrahim. My name is Aqsa Nayab, student of BS MLT 8th semester, Aqsa University, Guwahati. Registration number is MLT120192004. Teacher Dr. Niaz Muhammad, semester 8. Today, the topic of my presentation is hepatitis C virus. Outline of my presentation is introduction, epidemiology, route of transmission, pathogenesis, types, natural history, signs, symptoms, and diagnosis. So, first of all, we discuss the introduction of hepatitis C. We discuss hepatitis C virus, what it is. Hepatitis C is viral infection of liver caused by hepatitis C virus. Hepatitis C virus is single-strand RNA virus. Single-strand RNA mean 8 virus families whose member infect vertebrates. Hepatitis C is linear single-strand 9600 nucleotide RNA virus. Linear mean they are arranged or progressing from one stage to another. The hepatitis is enveloped virus. Two viral envelope glycoprotein E1 and E2 are surrounded in the lipid envelope. At least 6 distinct major genotypes as well as greater than 50 subtypes within genotype of HCV have been identified by nucleotide sequence. Genotype mean genetic makeup of organism. HCV1A, HCV1B, HCV2A, HCV2B, HCV3A, HCV3B, HCV4, HCV5 and HCV6. Next is epidemiology. Now we discussed about the epidemiology of hepatitis C. Global burden of hepatitis C is major public health problem worldwide. Global burden mean provide a comprehensive picture of mortality and disability across country, time, age and sex. About 180 million people are infected with hepatitis C virus. It accounts for 3% of global population. 3 to 4 million people become infected with HCV annually, and about 25 million people are infected in Europe. Global burden of hepatitis C, more than 350,000 to 5 lakh people die every year from hepatitis C. Infection with hepatitis C HCV mean remain chronic in 70 to 80% of infected individual. Infected individual mean a person affected by organism that can cause disease. In 20 to 40% cases of chronic hepatitis C infection lead to end-stage liver disease, cirrhosis, hepatocellular carcinoma, and liver failure after 20 to 30 years of HCV infection. Liver failure from chronic hepatitis C is one of the most common reasons for liver transplantation. Next is transmission of hepatitis C. How it's been transmitted. First is parental route. Parental route means intravenous administration of nutrition and medication bypassing the GIT system. Transmission route of HCV, transfusion of infected blood or its product using non-sterile syringes, needle and medical instrument, transplantation of infected donor organ or tissue, occupational exposure with infected blood material. Next is sexual route. Risk of sexual transmission of HCV is very low in monogamous partner about 2%. Monogamous mean relationship between only one partner at a time. Next is mother to child. Mother to child chances of vertical transmission of HCV is about 5 to 7%. The risk is increased if HCV viral load in mother blood is high. HCV not transmitted. HCV is not transmitted by air, droplet, vector or from animals. Pathogenesis of hepatitis C. The virus replicates mainly in hepatocyte of the liver where it transmitted daily. Each infected cell produces approximately 50 virion. Virion mean virus particle. Hepatocyte mean major parenchymal cell in the liver. Because HCV does not replicate in by DNA intermediate, it does not integrate into the host genome. To enter the host cell, HCV E2 and E1 protein recognized and bound with CD81 receptor present on the surface of hepatocyte and lymphocyte. Lymphocyte mean in the form of small leukocyte occurring especially in lymphatic system. After interaction of the virus enveloped with the host cell membrane, HCV enter the cell through endocytosis. In cytoplasm, the messenger RNA then undergo translation and polyprotein are processed. The HCV RNA then replicate, after which the new viral RNA are packed and transported to the surface of the host cell so that they are disseminated and complete a new cycle. In this diagram, the whole pathogenesis process are shown. Next is classification of hepatitis C virus. Hepatitis C virus are classified into two types: acute hepatitis C and chronic hepatitis C. Incubation period of HCV is about 2 to 26 weeks. Acute hepatitis. First we discuss acute hepatitis. Acute hepatitis means new infection which occur for 6 months. Acute hepatitis is infection disease caused by hepatitis C virus which develop within 6 months after entering virus to the organism. Disease is symptomatic. Symptomatic means they have symptom with jointness and not without jointness. Asymptomatic means they have no sign symptom. Next is chronic hepatitis. Chronic means their long-term infection. Chronic is hepatitis C is chronic infection caused by HCV which develop after 6 months from acute phase of infection. Chronic hepatitis C is main form of HCV infection. It is chronic in 70 to 85% of infected individuals, usually progressive slowly and characterized with non-specific clinical symptoms. Next is natural history. Now we discuss natural history of hepatitis C. Acute HCV. From acute HCV, the symptomatic chances is 25%, asymptomatic 75%, and symptomatic jointness and without jointness. And the recovery chances from symptomatic is 30 to 52%, and the recovery chances from asymptomatic is 10%. And from acute HCV, the recovery chances is 15 to 30%, and chronic infection chances is 70 to 85%. So this is the natural history of hepatitis C virus. Sign and symptom of hepatitis C. First is fatigue. Fatigue means extreme illness. Next is nausea and vomiting. Nausea means feeling to being sick to your stomach. Next is abdominal pain or discomfort, especially in the area of liver on the right side under your lower ribs. Clay colored bowel movement. Bowel movement means movement of feces, undigested food, bacteria through the bowel and out the anus. Loss of appetite, low grade fever, dark urine, joint pain, yellowing of skin and eyes, jaundice, main symptom of hepatitis C. Now we discuss the diagnosis of hepatitis C. How we diagnosed hepatitis C. On serological base, detection of anti-HCV antibodies and serological tests available since 1990, and molecular level PCR, HCV RNA detection, determination of HCV genotype, viral load determination. Elevation of serum aminotransferase occur in 2 to 12 weeks, and ELISA. HCV RNA can be detected even before acute elevation of aminotransferase activity and before the appearance of anti-HCV in patients with acute hepatitis C. So this is my whole presentation about hepatitis C. Thank you so much for watching my presentation. Allah Hafiz.